My name is Wayne Larson. I'm the Director of Communications and Marketing for the City of Mesquite here in Texas, and we appreciate everyone that's watching now live or in the future as we are recording this Community Health Forum. Most of you probably know, and if you don't, we'll let you know that this is a series of health events, health forums, virtual health forums as a part of our Recovery Mesquite campaign, which is a campaign we started last year during the COVID-19 pandemic. And Recovery Mesquite is about aiding our community and moving forward and onward through the pandemic and just a variety of ways, whether it's financial resources, job assistance, job training, and now health tips and health resources. Today's topic is, we have a different topic every month. Today's topic is minority health, and you might be asking yourself, why minority health for this month? And that's because April is a National Minority Health Month, and it's a great time to raise awareness about health tips and health issues that affect racial and ethnic minority populations across the country, but particularly here in our community. Before we get started, let me take a moment to introduce our two esteemed panelists. We sincerely appreciate them taking time out of their very, very busy schedules to be with us today. Dr. Jaime Davidson is the clinical professor of medicine at the Diabetes Touchstone Center at the University of Texas Southwestern Medical Center. And our other great panelist with us today is Dr. Laura Lee Hall. She's the president of the National Minority Equality Forum Center for Sustainability, Healthcare Quality and Equality. So thank you all for being here with us today.
Thank you.
Pleasure. Thank you for inviting us.
You're most welcome. We're just very grateful for you taking the time. And then before we get started, we also want to extend a tremendous thank you to the National Minority Equality Forum. It's an organization that provided these two great speakers. And the forum is basically a research and educational organization dedicated to ensuring that high-risk racial and ethnic populations and communities across the country get the best health care they can. And part of that is through education. That's what we're going to do tonight with a series of questions back and forth. We are recording this for the community to take a look at later and to share with their family and friends. And then after we have some questions with our panelists, we'll open it up for any public questions that we can field. And we'll try to keep this to an hour or less. So with that, let's start with probably the biggest issue still going on in the world, and particularly in our communities, and that's COVID-19. The Minority Health Month theme, ironically, for this year is #VaccineReady. So with that, Dr. Hall, I'll start with you. What are some of the racial and ethnic disparities in COVID-19 and particularly the vaccination?
Well, I'm actually going to share my slides, and I'm going to, after answering your question briefly, really ask Dr. Davidson to go in it. So I'm putting my slides up. Did a little research about your community too today in regards to COVID-19 and other health disparities. I am only putting this slide up to show you that what you already well know, it isn't over yet. And if you look at the United States data as of today, there has been 14% increase over the last 2 weeks in number of cases, although the death rate nationally has been declining. So in Dallas County, you see the rate of 2 weeks of change is going up 6%, although your death rate, thankfully, is going down quite steeply. Kaufman County, actually, even your case rate is going down at this moment. But I did want to point out to you that while we're still in a pandemic, we are also offering many vaccines around the country but that some of the populations most hard hit are not getting their share of the vaccines. And I'll just point out to you, in case of Hispanic populations in Texas, while they make up, this population, 41% of the cases, 45% of the deaths, and 40% of the total population, as of March 29th, they only received 28% of the vaccines. So, and a similar disparity is true also for the Black population. So there's some disparities in access. I'm going to stop sharing now and turn this question over to Dr. Davidson to talk about disparities and COVID-19 in the vaccine.
Well, I want to start with something that I want to show everybody, and the first thing is, how to wear a mask, okay? Because even if we are vaccinated, we still have a chance to get infected. It's small, it's 5% with some vaccines, maybe 10 to 15% with another vaccine. But this is the way to wear it. It needs to be tied around here. You need to cover the nose. You don't breathe with your mouth. You breathe with your nose. So this is not the right thing. And I see a lot of people like this. So please do it correctly. The other thing that I want to show you is, if you are in large places with a lot of people and the distancing is not correct, you need to put some actually eyeglasses to protect you as well. We know that you can get, COVID, through your eyes. So if you have a lot of people, especially if you're coughing, cover your eyes. If you're already vaccinated, you may not need this. Actually, if everybody in your family is vaccinated and you only have people vaccinated with you, you don't need to wear any of those things. But remember, very few minorities, Latinos like me, I'm Jaime, and Jaime is from Latin America. So, we sometimes are afraid from the vaccines. We don't know if they're doing something to us. Believe me, the vaccines are very safe. Please take one of the ones they offer you. One day it may be Janssen, one day it may be, Moderna, one day it may be Pfizer. Whatever they offer you, please take it, okay? Don't doubt it, because the vaccine is very, very safe. You have some symptoms. I have some aches and pain in my arm. The second one, I have a little, temperature, nothing for one day. Remember, they're mild symptoms and they go away.
And I will say too that my husband and I, being older, have received 2 doses of the Pfizer vaccine, and we had nothing but a little sore arm both times. We didn't even have any fever or fatigue. So I echo our positive experience. And I would suggest to you, Wayne, that while convincing, our goal isn't necessarily to convince people to do things without being mindful of their own opinions and things they have learned and their own fears. It's partly conveying. And so I think that Dr. Davidson and I are both trying to convey the data we know and our experiences so that people can come to a good decision to promote the health of themselves and their families.
That's a great segue, Doctor, because the next question that we were going to ask both of you was, what are some tips and some ideas that you have that you've seen out there in different communities and what the data shows about really helping promote the acceptance of steps to avoid, getting COVID-19 with social distancing and hand washing, but more specifically, getting the vaccine within the minority populations. Have you seen anything out there? Or what sort of tips? What could you say about those items, particularly to ethnic populations?
I would be glad to start again and then let Dr. Davidson really come in and talk about this from the perspective of a clinical researcher. So I'm going to move ahead from these slides. I'm going to come back to them though. First of all, I would remind people that people of color actually do trust their doctors. So I would urge those of you in the medical profession to, be confident that you have the trust and that your patients will listen to you. They may not act on it after the first visit or recommendation, but you are really the most trusted voice for them. Guess who else has a strong voice in terms of providing a trusted message? It's the family of people of colors. This is a big project, survey project among African Americans, but people of color care about their families and listen to their families, their spouses, their partners, their children. We should not neglect having respectful, non-enraging conversations with our loved ones. Community organizations. So Wayne, like you yourself, but also all the wonderful organizations in your community, their members know them and trust them as well. So it's like your peer group, the group of people that you actually believe in strongly. These are the people who can help everyone come to a good decision about protecting their health and their family's health. I don't think we should let ourselves off the hook either, because research has shown, even through the end of March, that less than half of Hispanic populations have had any news about the vaccine in their language. So, it's not like we can condemn a population if we haven't even provided the information in a way they can understand. And that's what this slide 2 shows from a national survey, that while there is a lack of vaccine confidence among some people of color, just like there's a lack of vaccine confidence in other demographic groups, many people simply are afraid of the side effects, or don't know very much about the vaccine, or maybe want to see what's happening for a month or two, or nobody has given them the information they need to understand it. So I'm going to stop sharing and let Dr. Davidson share his clinical acumen around this.
Well, being a Latino and taking care of patients of Latino origin, I will tell you that there's still some distrust, in the medical community if you don't speak the language. Many Latinos, like myself, have very basic English knowledge. So all the messages should be in Spanish, and I know in Mesquite, we have many Hispanics living in Mesquite, and they may not understand what we're talking tonight. Okay. So you made a big point, 50% of us, because of language barriers, maybe have not listened, to the needs for the vaccine. So we need to work together, with the news media, with radio and television, because, Latinos, we watch TV and we watch actually, we listen to the radio, and we need to have those things in Spanish. The preferred language at home is in Spanish. And I will tell you one thing, you may not believe it, but in the Latino community, the person that makes the decisions in health issues is the wife or the mother or the grandmother.
I think that's across all households.
That's true.
That's the way God made it.
We accept it, So, convincing people like the mother, how important the vaccine is important, and I think that, once we understand, we actually will do it, because we know now that we're suffering a lot more from COVID than other populations, and that we have actually a way to prevent it, many ways. But one of them is vaccinations, and it's free for us.
Well, you both make phenomenal points when you talk about trust and listening to peers. Here in Mesquite, we have an extraordinary set of relationships with our local NAACP and also a Hispanic group called Hispanic Forum of Mesquite. And both HFM and the NAACP have been phenomenal partners with the city on a variety of efforts across the board, and they are always champions for our message. So your points are well taken, and we'll definitely look to partner with them. They certainly have the contacts with their peers and that trust in our community. Dr. Davidson, I know one of your specialties is diabetes research and that type of study. Can you talk a little bit about the relationship between diabetes and COVID-19 and maybe any other chronic conditions that may not rise to the level of the news that we've seen or heard about diabetes and its relationship to COVID-19?
Absolutely. There are very important data showing that people with diabetes, people with asthma, people with other chronic conditions, with heart conditions, people with cancer have actually more COVID-19 and the outcomes are worse. So if you have diabetes, controlling your diabetes is very important. So if anybody is listening that has diabetes or anybody in the family has diabetes, please take your pills on a regular basis. Be sure that your sugar levels are within the norm. The doctor probably will tell you that before a meal, we want your blood sugars below 110. If for any reason, you think that your blood pressure pills are making you worse, that's not correct. Please take your blood pressure pills. Try to take your blood pressure once in a while. Be sure it's within the normal limits, 130, 140 over 90 or 80. Be well hydrated. Drink fluids. Wash your hands closely. If for any reason you have asthma, be sure that you actually take the medications to prevent those attacks of asthma. If you have an arrhythmia, heart conditions, talk to your doctor and see what you need to do. But the most important thing is be careful. Don't take chances. Cover yourself, wash your hands, do everything that is easy and inexpensive to do.
Dr. Hall, anything to add to that?
Well, I would like to add to, I can't match the expertise that Dr. Davidson has in understanding the biochemistry and clinical treatment of diabetes and other chronic conditions vis-a-vis COVID-19. But I would like to, again, I will share, because this helps me, I think, make my point. So I just wanted to remind everyone that there are other disparities other than COVID-19's occurrence and its impact, its mortality rate, and access to the vaccine. But there are other racial and ethnic health disparities in your region. So you see in this chart that the death rate due to cancer is higher among Blacks versus whites, you see in this, even though they both have the same prevalence. Prostate cancer, much higher in Blacks in Kaufman County. Diabetes death rates. So this is from Dallas County. I couldn't get it down to Mesquite. But you see that the impact of diabetes on Blacks and Hispanics populations is higher, as is coronary heart disease among Blacks. So, and death from influenza or pneumonia was much higher among your Black citizens. So this concern about COVID-19's impact on people with chronic conditions is especially important among your people of color. So it's kind of a double-edged sword, if you will, or a double whammy for them. But there's another point I would like to make. I don't think that people in a community who may have some mistrust or have experienced disparities, they're not only interested in COVID-19. So if you really want to promote health in your city, which I see you really do, then you got to stick with it. Stay with your partners who work with the community and work on cancer screenings, work on diabetes management, work on cardiovascular disease management. It's not just COVID. It's an ongoing support and promotion of health equity in your community.
And I want to echo, Laura Lee's words, because, one of the problems we have both in the Latino and African American community is obesity. And obesity leads to diabetes, to hypertension. In the Black community, if you have hypertension and it's poorly controlled, you get heart failure. So, those are very common. So, having fitness classes, trying to get better, actually, nutrition, lose some weight, keep active. Don't watch TV because most of the time the news are bad news. Instead, go and take a walk of 30 minutes and get fit. I think for both communities, for all of us, that's very important.
Both your statements and comments here segue into what our next kind of area was going to be. We've talked about the what's, the COVID-19 and some of the high risks. I wanted to ask both of you the why. Why are minority communities at such a high risk for some of these health issues that both of you have just talked about? And why are so many of these populations and communities, at high risk for some of these?
You want me to go first, Laura Lee?
Well, I will offer some thoughts about this. That's a complicated question. Certainly, there may be some biological reasons for differences between different populations of people, but I think that there's kind of a mixture of issues. So, one that we've often heard in the recent past is that the patients are somehow not health literate or don't have good health habits, or they mistrust the system. And there's truth to that, right? There are some patient issues. I think, though, we have probably gone too far in that direction, because I think there are some system issues and some social determinant of health issues. I mean, if people can't drive, they don't have a car, and you can't get to a doctor because there's not public transportation, that's an access issue. If you don't have health insurance, if you work 2 jobs and you don't have the ability to take time off to go to a doctor's office, if there are no resources in Spanish that can educate you to make good decisions, if there are no specialists, if there are no educational programs for self-management of diabetes, I think that we need to reckon with kind of how the whole system has not afforded people of color and people who are poor access for a myriad of reasons that aren't just because they're not willing to do the job. Dr. Davidson, would you agree with me? How would you phrase it?
No, I agree with you 100%. And, people that have to work from 8 to 5 because that's the only way they can sustain their families, may never go to the doctor. And in addition to everything you say, sometimes, we prescribe, we never ask, can you afford it? Do you have insurance for prescriptions? If a vial of insulin costs $350, if you need to pay out of pocket, it's impossible for a family that makes $10 an hour to buy insulin. So yes, access to good care, access to care, needs to be changed the way we do it today. We need to have more places where we actually hire minority people to have a local physician, something to do it correctly.
I want to ask,
Go ahead.
I'm sorry, Wayne, because I think when you look at COVID-19 itself and why there are disparities, I think research has been showing pretty strongly that people of color often live more people to a house, if you will, multiple families or multiple generations of a family, that these populations are often our frontline workers or essential workers. So somebody in the household is actually going out every day and has, probably not great access to a mask and other PPE. So I would remind us that some people of color are really, by no fault of their own, in a living situation and an occupation that has put them at more risk.
Our conversation tonight with this Community Health Forum, which again, for some of these who might have just joined us, it's on minority health. April's Minority Health Month awareness. Our conversation is really focused on COVID-19 and some of the different elements and impacts on the minority populations. But I wanted to ask both of you, what are some other health issues going on in the minority communities that we need to be addressing, communities across the country need to be addressing, that you might be seeing out there?
I will just jump in and say, now that the vaccine is being provided to more and more people, and I hope everyone can get access to it that's listening, let's catch up on all those cancer screenings. We have seen that there actually has been more death from non-COVID illness in the last year. And I know Dr. Davidson has done research on this. People need to catch up on their prostate cancer screening, on their and their lung cancer screening if appropriate, their breast cancer screening, their colorectal cancer screening. Catch up on all your other exams to see how your blood pressure, your diabetes, your other coronary artery disease. Go to the doctor, get your test, see how it's going, to see if you haven't lost some ground. Go to the dentist, which is a very important part of health. But let me turn it over to Dr. Davidson, who has great knowledge about this.
No, I think that you covered most of it. I agree with you again 100%. We cannot just focus only on COVID. Chronic diseases are very expensive, especially if they go untreated. And one of the problems that COVID caused, last year is, we closed clinics, we closed everything. People that have to have prescriptions for blood pressure, for diabetes, if they didn't have them, So today I recommend, if whatever you have, if you have a cholesterol problem, if you have diabetes, if you have hypertension, high blood pressure, please have at home at least 3 months of supply of your medications. Because you never know, we're much better in Texas, but remember, there are 5 states today that instead of going down, they're going up, and they're not going up slowly, they're going up rapidly, which means, the 70% of unvaccinated people, especially younger people, are not taking the precautions they should. So hopefully in Texas and in Mesquite and in Dallas County, we can keep it the way we are. We're doing very well right now. But we don't want to take a chance. We don't want to go up again. So please, anybody that has a chronic condition, try to see your doctor, take your medications correctly, have a 3-month supply in hand, because you never know what will happen. And what we tell you today that we're doing great, a month or 2 from now, I cannot promise you that we will continue to do so well.
Yeah.
I want to also build on something that Dr. Davidson said, that you often hear people saying we should build back better after this horrible year, this pandemic. And one thing that maybe we can all kind of get our hands around now, and I'm trying myself to do so, is to really do better health in terms of smoking and obesity, as Dr. Davidson said. If we started working on those 2 things, we would not only have less risk of COVID and serious COVID outcome, but we'd have less risk of all kinds of chronic diseases and would feel better. And so maybe this gives us an opportunity to, take stock of the way we have built our habits in our lives. And I'm taking full ownership of this on me, and try to turn a leaf and do a little bit better. Maybe that's an opportunity now.
Speaking of doing better, something that you mentioned, Dr. Davidson, that I found interesting, that, just some basic, inexpensive steps that all of us, but particularly minority populations, can take, such as making sure you're hydrated and things like that, can go a long way.
Correct. Remember, cover your mouth and cover your nose. Okay, that is essential. I don't want to see anybody just covering the mouth, because it does not help. Wash your hands. Don't shake hands. Don't. Latinos, we like to kiss and hug everybody. This time around, let's wait until we have this under control. Okay, if you have a chance to go to a park and walk for half an hour, at least 5 days a week. If you cannot do 5 days a week, 3 days a week, but stay active. Don't sit in a TV watching bad news all day long, please. Do something active. If you have children that don't live with you, call them on a regular basis, tell them what they need to do, because what we see now is that the older people, are not getting so much COVID. Now it's the younger people, the 20s and the 30s. We want them to be healthy, because they're younger, they do better, but some of them don't do so well. So why not prevent it? It's better to prevent it than to end up in ICU in a hospital for 2 weeks or 3 weeks, sometimes 2 months. It is expensive for the healthcare system, but it's more socially, difficult. You make families suffer. It disrupts the whole life of us.
And Dr. Davidson, our advisory group for our project on COVID vaccination among people of color suggested that there are three really kind of issues or groups that need to have education provided to them. One is people with various chronic conditions, as we've discussed. One is Hispanic populations, because there are relatively fewer resources that can help the public, the Spanish-speaking public, understand and take action for their health. Number three are younger people. They don't feel like it's that serious an illness. They don't trust the vaccine. They are the frontline workers and have been going out after it. They're a population that are now going to become the more at-risk population. And so, Wayne, in your city, you may take some special effort to work with your college students and your young adults who are starting their careers.
Correct.
Dr. Hall, you had mentioned a couple of minutes ago that you had, and we would go back to, you had a couple other slides that we wanted to show our viewers in your presentation.
Yeah, let me
skipped over
share you
some
what you
data.
got. So one point I made, and I think I'm sharing my screen.
Please.
So the first points I made were that there are disparities in your community that are important, and they have relevance to COVID-19, and they also have relevance for your ongoing commitment to health equity in your region. We talked about how healthcare providers and doctors and family members and trusted community members are really people who can convey a strong message. We talked about how Spanish-speaking populations have not gotten enough information to understand what they can do. So it's not just an issue of vaccine confidence. The last couple of things I would want to share is that people can really make a difference, and young people can make a difference. This group, We Got Us, who are in Massachusetts, they have created an act with students, community members, and others in the community, activities to really bring health to the community. And notice one of their comments are convey, not convince. So it's empowerment through education, but it's education, not I'm going to make you do this. And it is, as Dr. Davidson has said now repeatedly, practice good health, PPE, washing your hands, wearing your mask. In my own hometown of Annapolis, Maryland, the Hispanic population has been extremely hard hit by COVID-19 and yet received so few of the doses of the vaccine so far. And a group that really kind of went into the community and asked them about what they needed, learned they didn't have masks and they didn't really have much information. So they used that information to distribute masks, distribute information, and they're staying in contact with the population. They're actually getting the vaccine vans coming into the community. So if there's a transportation issue or if there's a work conflict issue, they're going on the weekends to where people live. And they're hoping to continue this in the future, as I hope your good city does as well. We have a lot of resources at NMQF, and you can go to nmqf-shc.org to find that information. So here's an infographic that you can share in doctors' offices, at the city building, in churches, that are practical. Got to keep wearing that mask even if you have a vaccine, etc. I would end my comments to this question, Wayne, and this opportunity. I would encourage everyone who wants to really promote COVID vaccination in your community, in your city, and health equity into the future, that they would sign up to become a champion with our organization. And we're going to have tons of materials, education, community assessment surveys, blogs. We will really train these folks, give them resources, and honor them nationally. Sign up at this sign up site right here. So those were just the other slides I had.
That's great. That's wonderful. One of the issues too that was brought up, and it's actually one of the questions as we transition out of our program into community questions. One of the questions I see in the chat is, what about mental health? Are you seeing anything out there in the minority populations? And Dr. Davidson, you're nodding your head. What are you seeing or hearing out there about mental health in regards to these populations?
Well, there's a lot more problems than the eye meets, especially number one, we're disrupting, the growth of our children by not allowing them, to be with each other. So, behavioral problems already occurring, in children and adolescents, and we need to actually get them back to school. Those that have not gone back, in Mesquite and Dallas, wherever we live, we need to be sure the kids go back to school to actually grow normally. Adults, also, they lost their jobs, they didn't have how to pay the rent, it's a very stressing situation. So yeah, mental health is a big issue. And I recommend to all my patients, talk to friends. Don't, if you have free time, if you have a problem, you need to let it out, and sometimes your family, your friends, you have a problem with one of your children, call the pediatrician. There's a nurse, there's a PA there that can help you, but don't let things go too long, because mental health is an issue. But I'm more concerned right now in our younger kids, and our adolescents, because they're going to be growing up, not understanding what is interaction, social skills, and their depression. We know there's a lot more, problems with suicides these days. So we want to be sure that if you see somebody in your household that is exhibiting things that they didn't exhibit before, like crying, not communicating, upsetting, please call your physician, call your pediatrician, call your physician, call your family, call your friends, talk to them. Have other children that come to your house, to practice social distancing, but don't let the kids be isolated, please.
Dr. Hall, anything to share on that?
Yes, I have a few thoughts about it, but I really appreciate, Dr. Davidson, your words. I do think most people actually are experiencing some serious stress and maybe even depression. I would ask us to remember that there are many people who, before the pandemic, struggled with severe mental illnesses and substance abuse problems, and they have had less access to vaccination. And we know that deaths from overdose have gone up this year. That, there is a strain on the health system and the social services system, but there are people who are really suffering out there. We know that there has been more kind of spousal abuse and child abuse and people stuck in their homes. So there's some serious behavioral issues. I would also remind us that we don't often have good access to behavioral health care in all communities and zip codes, if you will. It's a huge need that this pandemic has only exacerbated.
Well, with that, you kind of opened the door there, Dr. Hall, and I'll kind of step through it. Here in Mesquite, we've taken mental health very seriously, and for those watching now or watching later, we have basically a repository of mental health resources that we have in our community, whether it be from our school district for the kids. We offer free mental health referral services through another organization for adults. And anyone wanting a list of those resources can simply go to our website, cityofmesquite.com/mental health. And there's a whole repository there of mental health resources, all of which are free. So that's kind of a selfish plug for the city. We had another question come in the chat. We're running out of time, but I did want to address as many of these really good questions as we could. There's one that just popped up, and we had nutrition as a topic in a previous health forum, but someone's asking about nutrition. If any one of you could offer your insights on simple, inexpensive nutrition steps they can take, especially in the minority population, to remain healthy in this situation.
Do you want to go first?
Go ahead, Laura Lee.
No, I will. I think this is a huge issue, right? It's in many poor communities and for many poor people, including people of color, it's just cheaper to get a Big Mac or a bag of potato chips or a pizza or a couple tacos than it is to get a salad and a piece of fish broiled. So just access to healthy food can be a real challenge for some people. I think also some of our cultural background is intimately tied up with the kind of food we prepare and eat. I have a Hungarian mother, an Italian father, and man, I love that food. There's just nothing like it, but they don't really make those recipes for the healthful benefits always. So I think that, learning how to, honor your culture and your background, but to do so in a healthy way with the guidance of a dietitian or even a peer group, support group can be helpful. But Dr. Davidson, I'm sure you have some much more important advice.
Comfort food, inexpensive food that people can afford. You can buy a hamburger for $1.20 and that is 650 calories. People are going to go there. And again, during this pandemic, people that didn't have enough money, that's where they went, French fries and hamburgers and, some of those tacos that are, full of grease and things like that, and I think education is very important. But Clifford, I want to congratulate you for some of the things you said. You are offering some of those services in your area. And for me, that is, if people know that, and they use it, I really need to congratulate you and your place.
Well, we promised we'd keep this to about an hour, and we're kind of there. I wanted to kind of end with any final comments from either one of you, any last kind of words of wisdom for our viewers on health in general, specific to minorities, anything that you'd like to finish up with and close us out with. Dr. Hall?
Well, I'm glad Dr. Davidson will get the last word. I would simply, I would offer to you and everyone in your community, congratulations for the good work you're doing. Any support we can provide, we are glad to do so free of charge. As I said, we have resources, we have training opportunities. We can hold up what you do well as a beacon to like communities as well. And it can go, it's not just for COVID. Let's get this darn pandemic over, but let's really nurture and help you nurture your own community's health and health equity. I'm I'll turn it over to you, Dr. Davidson, for last words.
No, I think that the resources that, you're offering are increasingly demanding for people. So I hope that you're going to use the offer from Laura Lee to get some of the materials that we have. Now, I want to finish by also telling, that, sweet drinks that are very common in our communities, not only the Latino community, Hispanic community, but African Americans. All these soft drinks that have 190 calories, it's pure sugar. It doesn't hydrate you. Plain water, please don't buy any of those drinks. They're bad for your kids. They're bad for you. And, you just with that, you're going to save money and be healthy. Don't forget, please go out, fresh air, walk half an hour a day, and be healthy. Stay away, follow the rules. And I want to thank you, Cliff, and your group for the invitation, and also Laura Lee for including me.
Well, I cannot thank you enough for the time both of you have given us. Dr. Davidson and Dr. Hall, the information you provided us has been most valuable. The information, the stats, the infographics, just extraordinary information. So I want to thank both of you for your time. Also, a tremendous thank you from the City of Mesquite to the National Minority Quality Forum and their staff and your PR team, Kelly at Vault Lab. They were tremendous to hook us all up and to make this idea.
They're great.
Make this idea become a reality. Yeah, they really are. Kelly and her team and all of them. Just a reminder, we mentioned mental health a little bit. Again, a selfish plug. We do this every month. Next month is a focus on mental health. Why? Well, May is Mental Health Awareness Month, so we're always looking for those hooks. And so May is Mental Health Awareness Month, and we will bring awareness about mental health and the uptick in suicide and things of that nature next month. And for anyone watching or who shares this, we have a repository of this forum recorded, as well as all the other forums in the past and moving forward at citymesquite.com/community health forums. And that's where these conversations, these discussions, these wonderful ideas will live and have a long shelf life for anyone who would like to share them out there, email, social media, that type of thing. So again, Dr. Davidson, Dr. Hall, thank you so much for your time. We really appreciate it.
I'm just putting up our bid for someone to sign up to be a champion. I hope we have someone from Mesquite in our community champion.
We want that trophy.
Oh, we totally want that.
Okay, we're going to put it there, Mesquite. All right.
Let's go, Mesquite.
Go, Mesquite.
All right. Thank you, everybody. And thank you and good night.
Good night.
Bye-bye.
Thank you. Bye-bye.